Coronavirus infections in the U.S. are showing no signs of slowing down. Nearly 63 million Americans have contracted the virus since the start of the pandemic. The daily new case average is now more than 750,000, with more than 1,700 deaths every single day. And the CDC says the Omicron variant is now responsible for 98% of new COVID cases. It's taken over. Currently, the number of people hospitalized with COVID-19 nationwide has already surpassed last winter's peak. And it's not just adults. Pediatric hospitalizations are also at their highest point of the pandemic. The Biden administration is now increasing federal support to keep students in school. Carter Evans has the latest from here from Los Angeles.
As the Omicron surge swamps the nation, a major announcement from the White House. 10 million free rapid and PCR tests will be sent to schools each month in an effort to keep kids in the classroom.
The nation's schools can and should be open.
In Chicago, students are back in class with additional COVID testing following a week of turmoil after teachers said schools were unsafe.
The fact that they're back in person with their friends, with their teachers, it's just such a game changer.
In Los Angeles, every student needs to prove they're COVID negative, but 78,000 students and staff tested positive after the winter break. And as the new semester began, 30% of students were absent.
We're not going to eradicate this, but we ultimately will control it.
Today, Dr. Anthony Fauci gave a blunt assessment of the new normal.
That virtually everybody is going to wind up getting exposed and likely get infected.
A new study shows that compared to Delta, the risk of death from Omicron is 91% lower, and the risk of ICU admission is 74% less. But hospitals across the country are still overwhelmed.
When it comes to people who are getting very sick in the hospital, who are they?
It's mostly patients who have not been vaccinated.
And nurse Zenny Triunfo-Cortez says it's creating a strain. It's so bad that asymptomatic healthcare workers in California who've tested positive can return to work immediately.
As a nurse coming to work knowing that I am COVID positive, I have the potential of further infecting my patients and my fellow coworkers, which is morally wrong.
At this hospital in Burbank, they say they're seeing a lot of people coming into the ER for other reasons and then also discovering they're positive for COVID. Most are able to go home and quarantine. But because this is so highly transmissible, the Biden administration is now considering a plan to distribute what it calls high-quality masks to all Americans. Lilia?
We all need better masks. We all need better masks. Carter Evans, thank you. For more, Dr. Adrian Burrowes joins me now. He's a family medicine physician in Florida. Thank you for joining us. Doctor, there's certainly an alarming spike in cases and hospitalizations as well in Florida and across the nation. What is driving this surge specifically in your state?
So if you're talking about Florida specifically, we've got a lot of things contributing to that. One, a lot of tourists, right? We have a lot of people not wearing masks. We have a governor who has not been as proactive as he needs to be in promoting the health of the population here. You know, Governor DeSantis has fought teachers who have been trying to get the students to wear masks to school. And he's trying to, quote unquote, protect the rights of Floridians. But, you know, we all have the right to be healthy. And so mask mandates, you know, being shot down by the governor are one of the reasons why we're spreading coronavirus to the state of Florida.
You know, I keep talking to my dad, who's also a physician in Florida, and I'm asking him, you know, what's the reason? He also says there was so much vaccine hesitancy during the entire pandemic. What are you telling your patients and to anyone out there who's still choosing to stay unvaccinated?
Sure, and a lot of the vaccine hesitancy has been when people are seeing some people getting vaccinated and still getting diagnosed with coronavirus. The reality, though, is that the people who are vaccinated who do go ahead and contract coronavirus are having very, very mild cases, not a lot of hospitalizations in that group. We're seeing a rise of hospitalizations in people who are unvaccinated, who are still going into the ICU. And we're also seeing, unfortunately, cases in people under the age of 5. And the pediatric population has not really been the population that we've been seeing hospitalized. But recently, we've been seeing the numbers of the pediatric cases skyrocketing as well.
Yeah, that's right. I mean, those numbers of children hospitalized with COVID-19 have been soaring. And of course, not just there, but nationwide. What advice do you have for parents who are concerned about sending their kids back to school, seeing as there's so many efforts and initiatives and debates around getting kids back in the classroom?
Yeah, so I think that we found out that students really they learn better in class, and I understand why all these local governments are trying to get students back in school. But I tell the parents, make sure that your child is as protected as they possibly can be. If they're able to be vaccinated, they're 5 and up. Go ahead and get them vaccinated. Make sure that you encourage their use of masks when they're at school. Explain to them the importance of doing that. Make sure they keep their distance and wash their hands frequently. Those are the mainstays of keeping safe, not just for children, but for all Americans. And unfortunately, the adults have been poor examples to the children.
Masks, testing, those are some of the tools. But of course, the main tool to fight the pandemic that we've all discussed is the vaccine. Now, European Union regulators have been warning that frequent COVID-19 booster shots could actually adversely affect the body's immune response. Can you explain to me what they mean?
Yeah, so, there's Israel. I'll use Israel as an example. Israel has been, ahead of the pack in terms of, trying different things. And so Israel has already given out their 4th shot, in some cases. And so in other words, the people have had 2 boosters. And the reality is they're giving them at 4-month intervals. And the more you do that, you actually tend to fatigue your immune system. Your immune system is constantly fighting and you keep making it work. And so it's like beating a tired horse. The immune system is trying to develop a response, and you keep giving it these boosters, and you can tire it out. So right now, that's why you're seeing the UK, the United States, they're not giving an additional booster because people are doing really well with the Pfizer booster. They're doing really well with the Moderna booster. So just continue to give these boosters without really a scientific reason to do that is probably not going to be healthy in the long run.
Got it. So not overcharging our bodies, because the body will get exhausted to actually fight the virus if it reaches it. Dr. Fauci says the highly contagious Omicron variant will find just about everybody. We just heard it earlier in the program. If that's the case, could we reach that herd immunity that everybody's been talking about? What do you expect the future is going to look like?
Yeah, I think that Americans have been given this term herd immunity, and everyone gets excited that we can reach that. The reality is, with each variant is kind of shifting what the herd immunity actually means. So when we first started out with the pandemic, we were thinking a number probably around 70% would get us herd immunity. Now with Omicron, we're thinking that it might be 90%. And the problem with coronavirus is that, unlike some other diseases, you contracting coronavirus does not mean you can't get it again. So it's really hard to achieve herd immunity with a virus that has so many variants, but you can also contract more than once. So I tell Americans, don't worry about herd immunity. Just worry about your mask wearing, getting your vaccine, social distancing, washing your hands, doing what we can do. We can't control how the virus behaves, but we can control how we behave. And that's what I would recommend to the people watching this broadcast.
And wearing the good masks, those N95 or KN95, not the cloth masks anymore.
That's correct. If you can get one, that's the preference.
Dr. Adrian Burrowes, thank you for joining us.
Thank you.